Good afternoon, everyone, and welcome to our session, Innovation Within Information Referral. And today we have with us Lydia Sequeira from Kids Help Phone. She is the Director, Services, Programs, and Innovation and Implementation. And Lydia, we're so happy that you're with us. And we're starting a few minutes late, so why don't you just take it away, and we're ready and willing and everything to hear what you have to say.
Amazing. Thank you so much, Michelle, and apologies to everyone. There's a little bit of technical glitches on my end, so I'm glad I was able to join. I'll keep it rather quick so that I can allow question and answer time towards the end of our presentation. Hopefully everyone can hear and see my slides okay, and even see me. I don't see that my video is on, but I'm gonna just kind of go on for, I didn't turn on my camera on the bottom. So hopefully everyone can see me and slides now. So I'd love to talk to you about a major piece of innovation that we've been working on in the information referral team, and a brand new product that we've been working on for the last little while that recently got launched. And the product is called Resources Around Me. And you'll see the 2.0 here because we did have an initial version of it. And I'll talk you through a little bit about our journey on why we revamped it and what were some of the challenges that folks had with the original information referral tool, and how we've kind of incorporated our end user voice. For us, that's the youth of Canada. And I will actually also just start by talking a little bit about the organization for folks who haven't heard about Kids Help Phone before or don't know what we do. The information referral team is one part of our larger organization, of course, and I will maybe give everyone a minute to read this. This is one of the quotes from a service user that called in for our newcomer services, and I'll kind of then walk through the rest of what we do.
So Lydia, hi, it's Marcus. Just a reminder that we are seeing things about 10 seconds behind you, so just give people a little extra time.
Okay, awesome. Thanks. Okay, I will happy to go back to this at the end as well. I'll continue along. Just telling you a little bit about the organization again. We've achieved the #1 most trusted charitable organization in Canada, which is not a statement or an achievement that we take lightly. Youth trust us. We've had over 20 million interactions since the beginning of 2020, and this means we're constantly striving to do better, build better solutions, and co-design with the youth around us. This is a slide that talks about where we've come from and where we are now. Kids Help Phone as a charity was founded in 1989, so we've been around for about 35 years, and we are Canada's only 24/7 multilingual e-mental health service for young people, accessible from any community across Canada. We have a whole host of offerings. We have clinical single session counseling, crisis response, peer-to-peer, self-directed tools, health promotion interventions, among a few others, no upper age limit, and really kind of have been pioneers in virtual care and e-health solutions across Canada. This is some of our growth and kind of shows you, before the COVID and the pandemic, we were sitting at around 1.9 million interactions, and that's really grew quite largely since we've interacted and implemented a lot more new service points. I'm going to kind of skip through some of these pieces a little bit quicker, and I can always come back at the very end just to kind of get to the service navigation tool, which we're here to talk about and learn more about today in this context of the Inform conference. And where this specific tool sits on our larger stepped care model is, you can see here, within the circle of care, the services that Kids Health Phone provides range really from health promotion that you can see on the bottom left there to professional counseling. So really going up that crisis support or kind of stepping up into more care as young people want it, and stepping down into some of the more self-directed and informational tools and peer support when they might want that, making sure that we have all of the options available, because not everyone will want professional counseling at every time for every issue that they're calling in for. And not everyone will just need self-directed tools. So it's kind of that blended model. And the National Resources Navigation tool that I'm here to talk about kind of sits alongside this stepped care model, because it helps young people connect to community-based resources or other resources that might not fall within the Kids Help Phone bucket of or circle of care. So we're doing a good job to make sure that when young people want it, they are receiving the care that they need and want. And then when they actually want to step into maybe more longitudinal care or long-term care, they're able to do that as well through Resources Around Me. So Resources Around Me 1.0, if you've ever used the tool in the past year, before last week actually is when we went live with the new version, you would have seen all of these things. And so I'll tell you a little bit about what Resources Around Me does. It helps connect young people to over 40,000 virtual and in-person supports. We launched the first version of it back in 2014. And as you know, technology changes and there's more solutions, and whether it's database, backend management, or just front-end user design, we need to kind of change with the times. So this is what Resources Around Me is. We have support, and the 40,000 resources that we have in there really span across the social determinants of health. So we have support for mental health, for addiction and substance use, basic needs like housing, clothing. We have cultural programs in there, career-based pieces and post-secondary related supports, emergency and crisis, healthcare, Indigenous supports, peer, family, social. I won't kind of read, I have read almost everything here, but you can kind of see the breadth of supports that we collect and kind of put into our database, so that young people using the Resources Around Me tool can access more information into all of these supports. So we have an information and referral team at Kids Help Phone. Consists of librarians and some other folks who help with the data entry and putting things into our database as well. We have a whole evaluation criteria, and I've kind of highlighted this and brought this down into a couple of key inclusion criteria points that we kind of do a full check for every resource that's added into our database and updated every 2 years. We're making sure that they are accessible to all youth across Canada, regardless of financial status. So we only put free or very low cost resources into the tool or into our database. We obviously are focused on the youth audience. We have folks as young as 5 to as old as 29 access our supports. So this is generally the age that we actually look at in terms of eligibility for all of these resources. We look for resources that are available in English, French, or both, or either, along with ones that are also available in many other languages. We have a whole Indigenous team here at Kids Help Phone, as well as a equity team, which focuses in specifically on Black youth and newcomer youth. So we want to make sure that all of the languages that we're offering, that resources within Resources Around Me are offered in, are also inclusive of just a diversity of Canadian youth. We of course look for ones that are free of discrimination and ones where the organization that is delivering that program or that support also align with Kids Help Phone's values as a whole. In terms of impact for the first version of the tool, we've actually had quite a large impact, over 500,000 users since 2019. And here are just some of the top provinces with who used the tool. So Ontario, British Columbia, and Quebec being the top 3. And then now I wanted to talk a little bit about why we decided to rebuild it and why we've launched the 2.0 version of it. So we engaged with a lot of young people who have used the tool, who haven't used the tool. So kind of getting the breadth of perspectives from end users who are our focus, who we are building this solution for. Both young people and the caring adults, obviously recognize that finding supports and navigating which supports fit their eligibility criteria and accessing these supports are definitely a challenge. There are no online navigation services that are built specifically for young people, so we wanted to kind of create that as well, and we wanted to have a good search experience and ensure that young people always receive resources regardless of where they live. So in our old version, sometimes you would, search for certain things, and if it was a smaller community, it would be hard to find it because of the way that we mapped the resources on the back end. So we wanted to kind of change that and rebuild that part so that anytime you're looking for supports, if you don't find or if we don't have something that's specifically in that small community, we have something that is the closest one out, so people know that there is virtual supports or closer community supports that they can access as well. And then we wanted to think about just going back to that piece of not every community has a whole bunch of youth services or services that are eligible to all of the youth in the community. But there are a ton of virtual services across Canada, of course, Kids Help Phone being one of them, but so many others as well. So we wanted to make sure that all of these virtual resources that have a Canadian-wide or province-wide eligibility are also included and easy to find for young people and caring adults, along with a whole bunch of mobile apps as well that are coming around and being implemented more and more into care. And I'll talk a little bit more into detail about mobile apps and how we've kind of leveraged the strategy we've leveraged to include those. So we wanted to kind of diving a little bit more into the apps piece. We have recognized there's been work and a full community engagement that's been kind of championed and led by RBC Future Launch and Wisdom to Action. And the report, I've actually kind of linked it on the bottom over there. In that report, they say mobile apps, of course, done through lots of community engagement. They say that mobile apps are an effective mental health solution for many young people, obviously not for all, but there are thousands of apps to choose from and not an easy way to necessarily assess effectiveness, fit, or data governance. Many young people and adults can choose apps sometimes with little information presented to them. And we know that young people and caring adults are asking for support to find these appropriate trusted apps. So that's kind of where we thought about integrating apps into Resources Around Me, since we're connecting them to community supports, community in-person and virtual supports. So we thought it would be a good addition to also have mobile apps in there. And this is just a slide to talk about just the breadth of engagement we've done in order to rebuild. So we've had 2 youth advisory committees. One was actually led by RBC Future Launch and the Wisdom to Action when they were talking specifically about mobile apps. And then the other one is the one that we've used to just rebuild the entire tool. That's the larger Resources Around Me tool. We've had over 50 youth and caring adults engage in prototype feedback session once we got to that prototype stage after discovery. And then we've had 2 youth advisors with lived experience of searching and service navigation that were also a part of our redesign project. So this is just to highlight that we are committed to ensuring that youth are involved in all of the aspects of developing and implementing the services and programs here. So with that, I would like to kind of walk you through Resources Around Me. It's actually live, so I will put into the chat just after this the URL so that you can, or if you search it up, it is also, it's you can put in Kids Helpful and resources around me and you can find it relatively easily. But I'll just break down different parts within resources around me, and then we can leave it open to any questions at the very end. So we have a much larger website, and I'm just going to kind of pick through different snapshots. Towards the top of the website, we wanted to make sure that end users, whether those were youth or caring adults, have a choice in how they search for resources. So the first main way that we have for searching is that free text search bar. We've added a couple of different points, such as filtration points. So people have to select the type of access that they'd like to get, whether it's in-person, virtual, in-person or virtual, or mobile or digital apps. They can enter any search term that they like. We've also provided some examples on the bottom. And then they can also enter a location, especially for the in-person and virtual supports. On the back end in our database, we have included in there all of the options on what the coverage of a specific resource is. So that specific location filter helps dive that down and make sure that we're presenting only eligible options when people search for it. This is just a kind of cut and paste, many different versions. We have a whole bunch of filters once you get to the search results page. And you can see some of them over here, or some of them that are coming soon. So we wanted to make sure that folks can not only search for a resource, but once they're in that resource list, they can filter based on things that they have thought of, or they can kind of see, you know, if they want to switch between in-person or online or phone only, they can do that. They can look at accessibility options and filter through that. So this is kind of the it's broken up into multiple pieces here, but it all kind of falls along the left-hand side of our search results page. And this is a snapshot of what our search results page looks like. Just imagine on the left would be all of the filters as well. So this is showing in-person resources, which actually come up with, oh, sorry, I'm just looking at, yes, okay. Yes, there will definitely be time for audience questions. So this kind of allows us to have, this allows us to have both a map to identify exactly where these resources fall, along with just a very short description of what the resource is. They can easily click through for more detailed information, and that'll open up our detailed resource card. And this is the detailed resource card. Again, it's just broken up into two pages or two shots here, but it's all on the single page. This is just for purposes of the PowerPoint. This gives you an example of what a resource card looks like with all of the information, including a description, where the service is located, phone number, link to a website, link to the directions as well as the ability to share specifically that resource or to save a resource to print out a PDF list towards the end. So it's also good for caregivers or, caring adults, or you know, whether you are a service worker yourself, if you have young people that are coming to you and trying to navigate a whole bunch of resources, and you are able to co-create a list with them, it just gives you an easy way to save all of the resources that are relevant to them and then print that off for them, or save it for yourself for notes. So that option is available as well. This is the second version of our search. So the first was that free text search, because some people know exactly what they want or they have an idea of what to look for. The second is more, if you don't have an idea or you're not sure about exactly where to begin on resources around me, you can try our guided navigation or guided search experience. Here we have multiple different questions or sections that we kind of take folks through. The first is the access point. So this is similar to what is in the search bar for that filter. We want to kind of just hone in, because I said we do have 40,000 resources. So we want to make sure that we are providing the resources that are most relevant to the person searching. So we ask them how you might want to access your resource. And then we have a whole bunch of categories. Again, thinking about just the variety and the breadth of the social determinants of health. So anything from basic needs to violence and abuse to Indigenous or cultural programs, legal and finance related programs. So this is kind of all of our main categories. And then we kind of take folks down through, to the next question, which will be the subcategories. And then we take them down to the very last piece if they want to go that far. If folks just want to check out all of the related pieces that we have within violence and abuse, they can search and start the search with the current options. They're not forced to go down the entire pathway, but as they go down the entire pathway, it gets more and more specific. So youth or caring adults can stop at any point. And our information referral team does use the ARIS 211 navigation, the terms. So we actually have some of that leveraged, and that will come up in some of the as we go, to the resource type in number 4. So you might see a couple of those terms come up then, because that's how we categorize resources on our backend database as well. So now I thought I'll talk a little bit about our mobile apps database, because this was something that was completely brand new and things that we hadn't done before in the 1.0 version. This is something that we've actually done in partnership with a team at Harvard Medical School, the Mind Apps team. They have adapted into a very practical use the American Psychiatric Association evaluation framework, which I've listed over here. They take these 5 domains of evaluation criteria and have turned it into 105 objective questions, so that you're able to do all of the work. And by you, I mean our youth apps coordinator actually goes through each of the app that's added into the database through these 105 objective questions, and does the work to identify the answers to all of these questions. There isn't a single score that's assigned to an app. The aim of this evaluation is really to empower our end users to be able to sort through and have all of the information. So the presence of a feature, the absence of a feature. Example, within the privacy and security domain, for example, one of the questions is, does the app have a privacy policy? And it's a very objective yes or no question. And knowing that allows the young person to say, yes, I think I'd like to read more about it or learn more about privacy and security. What we also do is go into a level of detail that the young person or the caring adult doesn't have to. So within, again, the privacy and security bucket, there's another question thinking about data storage and whether the data is stored on your own phone locally or it's stored in a server or a cloud. So that's, again, another yes/no question that providing that answer to the young person or the caring adult allows them to make that empowered decision on whether they want to use that resource or not. And young people, I mentioned our youth mobile apps coordinator are actually very much part of the KHP team. So they are working with the Mind Apps team and making sure all of the apps that are in our database, in resources around me, are evaluated using this methodology, but are also relevant and safe for young people to use. This is just a couple of examples of the Canadian-specific priorities that we are focused in on, and Canadian youth-specific priorities in particular. So the Mind Apps database is a much larger database that is available here, and I put a screenshot of it, publicly actually available to all folks. And the focus of that and the goals of that is to create this app library of mental health apps for all ages. So we are actually taking and integrating with this specific database and only prioritizing the ones that are available and accessible in Canada, and are focused on youth, specifically those that are developed by youth, mental health professionals, or youth organization across Canada. And again, thinking about all of our inclusion criteria, like inclusivity about cost, and just relevancy to our goals and our values. We're also kind of putting that lens on as we choose the apps to embed within our resources around me tool. I had a couple of videos in here, which I'm happy to show at the very end. They're just demos of the actual resources around me tool, but you can also leverage and kind of look for it yourself. So I might come back if there are questions on exactly how this works or what that looks like in action. But really, it looks very similar to the in-person and virtual supports. This is just a list. Of course, we don't have the maps because these are all digital resources. It says who they're developed by and whether the development vendor is a for-profit company or a nonprofit company, just to provide people with all of the information that they need. And again, you can see at a glance all of the different apps that we have and then click into it for more detailed views. The last bit of innovation that I wanted to talk about with this Resources Around Me tool is we actually created a version of this tool that sits within another organization's website. So there are lots of resources and lots of community organizations across Canada that might have young people in their community coming to their website or coming to their digital spaces. So we've actually allowed resources and communities across Canada to embed Resources Around Me right within their digital page, so that the young person doesn't have to search up kidshelpphone.ca and visit our URL. They can actually get all of the same services, this entire website, available through the websites that they are accessing more regularly. So it's a couple of lines of code, and we're making it available at no cost to charities across Canada. And it's really just an embedded tool. And here's just an example of what it might look like. So you can kind of see two versions of it. You can either have the guided search experience or just the results page on here, and we can customize it based on location and type of resources that you want to show up in there as well. And then finally, I just want to say a huge thank you to our funders and partners. So for RAM, Resources Around Me, the Grocery Foundation, and the Ontario Ministry of Health are two of our large funders there. And then for the apps database in specific, both Canada Health Infoway and RBC Future Launch have also helped us be able to kind of make that all happen. And then for the apps database in specific, we were really kind of going off the foundational work that the MindApps team led by Dr. John Torres has led. And these are all of the other organizations that's contributed to that specific piece that I also just wanted to recognize. And then finally, I wanted to recognize our development vendor who helped us actually develop and build the tool, of course, alongside folks on our information referral team and our youth council, but that is the memo test team as well. So they are a for-profit startup that kind of build and design health tools, and so we actually leveraged their support for Resources Around Me. I think that leaves me to the end. Again, I've kind of skipped over a couple of videos, which I'm happy to dive into a little bit more detail, but I'll pause here to see if there are any questions or any pieces that people wanted me to dive a little bit more into detail on. And in the meanwhile, I'm also going to quickly pull up the URL so I can put it in the chat. I'm not seeing any questions coming in, but if there's anyone who is seeing it, feel free to unmute or let me know. I don't know if I'm looking in the right places. Awesome. So there is a question about just making sure the data is updated and accurate. And that's actually a really great question. So we have two ways of doing this. We actually work with the communities. So we have a system where every year we send out an automated email, and this is something that we've also leveraged in the last little while, to the main contact for that organization to be able to update and edit any of the programs and resources. You remove some programs or update the information that we have on there, for example, in terms of eligibility. That triggers our information referral team and our data entry folks to actually update that in the database. However, our information referral team are also doing some of that themselves. So we aim for every 2 years for each of the resource in our database to be reviewed at least every 2 years. With that said, we do have a very large number and we're always growing and adding new resources as well. So on Resources Around Me on the tool, we also have a form, two forms actually. There's a form that folks can use to submit a resource into the database with all of the information that we will then, our information referral team will then take away and actually work on the back end to make sure it fits our inclusion criteria before including it. There's also a form to suggest an edit. So if there's a specific resource that someone has opened that detailed card for, they're able to suggest an edit if they see something that is wrong. And then again, that'll trigger our information referral team to find the right information and do their work. But it'll just kind of prioritize and bring that to the forefront. So we've embedded recognizing that this is as much a community tool as it is kids' health phones. We want to make sure that all of the information that is in there is accurate. So that is kind of our process. In addition to doing it just ourselves, we also have these access points for young people, caring adults, or even organization members to be able to look for the information that's currently on there and suggest any edits where possible. I hope that answers the question. And then there's another question that talks about, are you working with Find Help? So we have a couple of different teams here at Kids Help Phone, including our partnerships team that work on a lot of different, so we have a lot of partnerships that I might actually not know about within my portfolio. For Resources Around Me in specific, we do kind of link out to 211 at the very bottom, recognizing that this is a tool and our database really focuses in on young people and the youth audience. And then we wanted to just make sure that if there's adults or anyone else that kind of doesn't see themselves reflected through here, that also want to find resources. So we've linked up to them. So we don't specifically have a partnership with Find Help for this tool. That being said, there might be some larger or other partnerships that I might not actually know about. Yes, thank you. Yeah, so the Good to Talk program actually is a partnership of Kids Help Phone, Ontario 211, Connects Ontario, and actually a fourth partner who's our evaluation partner, that is the Knowledge Institute at CHIO. Sorry, I'm trying to think of what the acronym stands for because I've only ever Children's Hospital of Eastern Ontario. And that is actually, I'll put in the Good to Talk goodtotalk.ca URL as well in here for folks to check out. This is a post-secondary institute service that's available to folks in Ontario and Nova Scotia. In Ontario, we also have, sorry, I'm just going to actually link us right to it. We have a campus services directory that again is a partnership between all of the organizations that I mentioned. And that is very similar to, a tool like Resources Around Me. It is something that our folks at Ontario 211 have led in the development of it. What that does is actually collates a lot of on-campus resources, some of which we have in Resources Around Me, but that is more specific to Ontario and Nova Scotia, Ontario-specific post-secondary institutes, but very much thinking about the same type of innovation, the same type of service navigation. We just wanted to make sure that young people who are not coming to, or post-secondary students rather, who are not coming to Kids Help Phone also have that option within their own campuses or nearby. So that is the tool there. It's called the Campus and Community Services Directory, and I've just linked it as well.
Hi, Lydia, it's Michelle. And
Hi.
since I can unmute and I don't have to type all the time, I'll just ask. Do you think that most young people that, in your experience at Kids Help Phone, are wanting to connect with you via technology, through apps, through their phones, rather than placing a call, or do you still take quite a few calls? What is it like? What's the landscape like there on that?
Yeah, the landscape is actually, we're seeing, this is kind of like the it depends answer, but we still have our counseling call that is phone based, but also live chat based. So for certain hours, our counselors who are paid professional counselors will actually provide services over live chat. And we've seen that option is just really popular and often gets a lot of traction, as do our phone calls. I think the types of calls, and I will kind of just preface that, our clinical folks and our clinical team is really the ones who spearhead and lead these. So I'm just going to summarize some of the pieces that I've heard. I know the counseling calls can provide very different types of support, different, people looking for just listening to someone and hearing someone on the other end. But I would say there's really been this uptake of all of the text-based ways of reaching out to folks. So our texting service has really exploded. It was actually implemented very early on during the COVID pandemic and has kind of just exploded since then. And over the last year, we've included or added another access point, which is called our online messaging access point. So this is going one step further. A young person who is looking for trained volunteer support through our crisis service doesn't have to text in. They can also just access it through an online version where they're able to, if they don't need a phone number or a phone plan, if they have access to Wi-Fi and a device, they're able to connect into a trained volunteer crisis supporter. So that's also, we've seen lots of use in that over the last, I'm going to say 5 months since it's implemented. And that's actually one of the services that's available through the Good to Talk service as well, as is with Kids Help Phone. It's called the online messaging service. And I just see a question in here about the age group. So Yeah, I will say that I think one of my slides said that there was no upper age limit. So really, we're not going to turn away folks that call in or text in or use our online message or chat features. The age group that we usually support is anywhere as young as 5 years old to as old as 29. That being said, of course, there is no upper age limit. We also have an adult texting crisis support line, which is also used, in the same way. So hopefully that answers the question. I don't know if sorry, I went a bit off board there.
No, that sounded great, Lydia. Are there any other questions for Lydia? Well, since we may get some other questions, but Lydia, did you want to go back and play one of your videos if it's short? Would that round out the hour for us, or?
Yeah, for sure.
Okay, but please, you go ahead and make that happen, and please, members of the audience, continue with questions if there's something that occurs to you, and we'll make sure that Lydia has time to answer them.
Sounds good. I'm gonna, sorry, give me one quick second. I'm just trying to get to, there's 3 videos actually that are embedded in here. And I'm thinking this might be an exciting one because it's the intro video. Oh, sorry. To resources around me. Can folks hear the audio as well? Here, you can see our
Yes, I can, yes.
Okay. Which allows end users to choose from our elevated free text search experience and guided navigation experiences. As you scroll through to the bottom, you can find examples of programs that can be found within resources around me, including local counseling services, Indigenous health centers, and student groups that support Black youth, just to name a few. Let's navigate back up to our free text search, which is helpful when you know what you're looking for, or you have keywords in mind, or are looking for a specific resource with a title in mind. Today, I'm looking for in-person mental health counseling supports near me. Our smart search will require me to enter a location to narrow down my search. So I'm going to put in Alberta because I'm curious about resources across the province. Here you will see our search results page that lists all the relevant supports based on my search criteria. You can also filter through the resources through one of our many filters on the left-hand side of the page, including cost, language that the resource is offered in, community supported, or accessibility options, to name a few. Once you click through into a resource, you can read a detailed description of the resource and access a one-click call number, directions, or save this for your search session. And since I have another couple of minutes, I might show the guided search experience as well. For a young person or caring adult and wanted to just explore the resources that we have within RAM, I would check out the guided navigation search. Here I can browse through all of the categories of resources and supports that we have within RAM and read through the different descriptions. If at any point I want to explore the resources within a specific category, I can start the search with current options. Alternatively, I can go back and choose another option and continue down until the very end to continue exploring. And then finally, this is the third explainer video. Here we detail a user's journey through the Canadian Youth Mobile Apps database. You can access it through clicking through the Apps or Digital Resources section, choosing the categories that you would like to focus in on. I'm going to select mental health as an example, and then select mobile apps. You'll see a very similar search results page with a revised set of filters that are specific to the mobile apps database. Finally, once you click through to a specific app, you can find links to download these on either app store or look for any other relevant details on here too. Awesome.
Thank you,
That-
Lydia. That gives everybody, I think, a really good idea of what it looks like and feels like. That's great. Thank you.